Exfoliating and scrubbing may aggravate the problem, but moisturizing, continue with your treatment, and ultimately letting your doctor know that there's no improvement. That's very important.
Hi guys, and welcome to another episode of Ask the Dermatologist, where we discuss some of your skincare issues with a professional. Have you ever had a reaction when trying out a new product? Well, today we are going to discuss purging of skin with Dr. Rangwetsi. She's a dermatologist based in Gauteng and also lectures dermatology at the Steve Biko Academic Hospital. Welcome, Doc, and thank you once again for joining us.
It's always a pleasure to be here. Thank you.
Now, I want to know from you, if there is someone out there who's thinking of becoming a dermatologist one of these good days, what advice would you give them?
I'll say you must be sure that you want to be in the field where you work with people, because that's very, very important. People's skills are not taught at university, so it must come from within. You must be ready to love people. You must be ready for very, very long hours and many years of studying, because you have to do undergrad, become a doctor for 6 years, and then you have to do 4 years of postgrad.
And that comes with a lot of patience, so I'm assuming you're a very patient
and hard
person.
work, of course. I am very patient, thank you.
Now, there's this term that's been going around, purging. How would you define purging?
So purging is a skin reaction that happens when someone introduces what we call an active ingredient as a treatment or a form of skincare routine on your face.
All right, Doc, so what are the common symptoms or signs of purging?
So purging happens a lot with, for example, acne. So you get worsening of acne before it gets better. So you have the comedones that we talked about earlier in the acne acid. You have cysts, you have pustules. They just become worse than they were before. Because when you start treatment, you're expecting to get better. But in this case of purging, it actually gets worse before it gets better.
So that means when I start a new product, I should actually expect to purge.
Yes, but remember, it only happens in about 20% of the population of patients who starts a new treatment. So it doesn't happen to everyone, but as dermatologists, we need to make our clients aware that this is possible.
It sounds like something that is very stressful. How can one manage purging?
So the first thing is patience. You have to let it happen, okay? And you continue with your treatment. You continue with the treatment as prescribed by your dermatologist or your healthcare worker, and just wait it out. Otherwise, you can consult with your dermatologist if it continues beyond 12 weeks, because this can happen around 4 to 6 weeks of you starting the treatment. So that's most importantly, is to wait it out or consult if it just doesn't get better.
Whenever this happens, we tend to want to find a quick solution. Is it advisable to try and scrub or exfoliate your skin?
Not really, that's not advisable. That might just aggravate the problem, because this, remember, is not under your control. It's the active ingredients that you're trying to use to get to the bottom of your problem. So exfoliating and scrubbing may aggravate the problem, but moisturizing, continue with your treatment, and ultimately letting your doctor know that there's no improvement. That's very important.
Thank you for that, Doc, but I think that's where we'll leave it for today. I hope you guys found that useful. If you want Dr. Rangwetsi to do a deep dive into today's topic, let us know in the comments. But until next time, take care.